This year, your medical options for health insurance are the same as they were in years past in regards to the carriers being offered. We have Anthem Blue Cross, which is the same as last year, as well as Kaiser in a base plan and a buy-up option if you prefer. We're going to be talking about the Anthem Blue Cross plan first, but please note there are no changes to the Anthem Blue Cross plan. It is still the Blue Cross Anthem Solutions 2500. Going to talk about the Anthem Blue Cross Health Plan. This is the Anthem Blue Cross PPO Solutions 2500. The 2500 is aptly named because it carries a $2,500 per member deductible per calendar year. If you're currently on this plan right now and started to satisfy that deductible of $2,500, that will continue to accrue for the remainder of this calendar year. The deductible runs on a calendar year, January through December. So if you've already started accruing this deductible, anything that you have accumulated will continue to accrue towards that deductible for the remainder of this calendar year. The remainder of the benefits are also unchanged. It's a $10 copay if you stay in network using a participating provider. $10 copay is associated with any doctor's office visit, including a specialist or for maternity and prenatal care. If you are hospitalized, the deductible does apply, meaning that the first $2,500 of your charges will be applied to the deductible. After that, you will have a responsibility of 20% coinsurance until you've reached a maximum out-of-pocket. This coverage is also the same for your outpatient surgery as well as the emergency room. Please keep in mind the emergency room also does bear a $100 copay. If you're admitted to the hospital, this copay is waived. For the prescription coverage, you have a $10 copay for your generic prescriptions. Brand name prescriptions are subject to a $250 deductible. If this is your first time purchasing a brand name prescription, you will be required to pay virtually the retail cost of the prescription until you've accumulated $250 of brand name prescription costs. This $250 deductible is per member and per calendar year. It is not per prescription. So if you have several brand name prescriptions, they could all go towards that one deductible. After you make it through that deductible, you then have a $25 or $50 copayment, depending on the classification of the drug. If it's non-formulary, it will be a $50 copayment. If it's on the Anthem Blue Cross formulary list, it will only be a $25 copayment. Some other services that you might encounter utilizing your Blue Cross plan would be for labs, testing, x-rays, or any other diagnostic testings that you may have done. These are applied to your deductible. So if you've already met your deductible earlier in the calendar year, you would only be responsible for 20% coinsurance for these charges. If you haven't met your deductible prior in the calendar year, then you would be responsible for the full amount of these charges, or the negotiated rate that Anthem Blue Cross has with these providers. Those charges are applied to the $2,500 deductible. There is a stop loss amount, and this amount is called a maximum out-of-pocket that you would be required to pay in 1 year. This is important to know should you encounter a catastrophic event, maybe a large surgery or an accident, anything that you maybe weren't expecting. It is important to know that you have an out-of-pocket maximum protecting you. For example, if you received maybe $1 million, $2 million bill for being in the hospital for several days, there is a point where Anthem Blue Cross does stop billing you, and that is $2,500 after the deductible per member. So you have a $2,500 deductible, and on top of that, a $2,500 out-of-pocket maximum. In theory, it would be $5,000 per member per calendar year. After that, all services would be covered in full except for the pharmacy. I'm going to go ahead and talk about the Kaiser Permanente plan, which is an HMO plan. And one of the primary notable differences about an HMO plan is that you need to use your primary care physician in order to seek care. So even if you happen to know you need to see a specialist, a podiatrist, orthopedist, you do need to start with your primary care physician first and see them for a referral to that specialist. On the Kaiser plan, the benefits are very similar to what they were the previous year. Their deductible has been increased slightly. It is a $1,500 individual deductible or a $3,000 family deductible. This deductible only applies to hospitalization type services, inpatient and outpatient, emergency room, and labs and x-rays and diagnostic testing. If you're going to the regular doctor office visit, specialist office visit, you have a $40 copay per visit. If you're going in for labs, testing, anything diagnostic, if you haven't met your deductible, then you will be paying full negotiated price for these services until you reach the deductible of $1,500. After you've reached that deductible, each encounter that you have with the lab or x-ray facility will be a $10 copay, unless it's an advanced diagnostic service, and this will carry a $50 charge. If you haven't met your deductible and you go into the hospital, the first charge that you will encounter is a $1,500 deductible charge. After that, your responsibility is 30% of the coinsurance until you reach the maximum out-of-pocket. The maximum out-of-pocket is the maximum amount of liability that any patient would have in a calendar year. For the Kaiser Permanente HMO plan, for this new plan that we have, it is a $4,000 per member maximum in a calendar year, $8,000 for a family. On the prescription coverage, you have a $10 30-day supply copay for generic prescriptions. If you have a brand name prescription, it's a 30-day, $30 copay. So it's a 30-day supply for $30. As an alternative to the plans that I've already presented, there is a Kaiser option which you can buy up to. This means that it would cost a little bit more out of your paycheck. However, your office visits and co-payments for other services might be a little less. This plan that's being offered is very similar to the buy-up plan that's been offered in previous years. It carries a $15 copayment for any office visit, whether it be for maternity, prenatal, well baby care, regular office visit, or a specialist. It's $15 per visit. Your lab and x-ray visits and any other diagnostic testings are covered at 100%. There is also no deductible for this plan. If you're admitted to the hospital, it's $250 per admission to the hospital. If you happen to have an outpatient surgery scheduled, it's $15 per occurrence. So just $15 for that one surgery you may have. If you are admitted to the emergency room, it's a $100 copay for the emergency room. If they admit you to the hospital, they waive that $100 copay and only charge you the $250 per admin. There is also prescription drug coverage, $10 for a 30-day supply of generics, and $25 for a 30-day supply of brand name prescriptions. There is a maximum out-of-pocket for this coverage. It's $1,500 for an individual and $3,000 for a family. Remember, this plan is presented as a buy-up option, so it does cost a little bit more out of your paycheck. However, if you're planning on having a scheduled surgery or service, this may be a good option for you.